Bismillahirrahmanirrahim. Assalamu alaikum. I am Dr. Irfan. I am final year medical student. I am here to present my history taking presentation. So first of all, thank you, sir, for giving me this opportunity. Let's start our discussion on history taking presentation. These are the steps of history taking. First of all, we learn how to approach to the patient. Like we don't know, sometimes we don't know how can we approach to patient, so we will discuss about it and information, biodata of the patient, then presenting complaints, chief complaints, history of presenting complaints, past medical history, drug history, allergies history, family history, social history, systemic review, and then we put all together, means it's a summary, and then we do physical examination and investigation, and then final diagnosis and treatment plan. So in the next slide, approach to a patient. So approach to a patient, we know, for approach to a patient, we being a good doctor, we need a attitude, means ke, how would I feel in this patient situation. We know patient how feel like he is ill, we have attitude like how he feel, and then we also adopt a behavior, always treat patient with kindness and respect, and then compassion, recognize the human story that accompanies each illness, and dialogue, listen to and acknowledge the patient, like we listen to the patient carefully, and we adopt a behavior and kindness toward the, because he is a ill person. So then we have confidentiality and consent from the patient, then personal responsibilities, dress, like we wear a proper dress, white coats, and also communication skills, expectations, respect, hand washing and cleanliness, because hand washing or cleanliness is important, because most of the hospital acquired infection can transfer from hand to patient, because a single doctor can examine many patients. So this is the main reason. So let's start approach to the patient. First of all, wash your hands and introduce yourself, give your name, your job, and also identity. Confirm you are speaking to the correct patient, name and date of the birth. Permission, confirm the reason for seeing the patient. I am going to question about your cough, is it that okay? And also position, this is the important thing. Patient sitting in the chair approximately a meter away from you, ensure you are sitting at the same level as them, and ideally not behind the desk and on the right side. So next thing is the hand wash and cleanliness. Why it's important? Because transmission of the microorganism from hand of healthcare workers is the main source of cross infection in hospital, primary care, surgeries, and nursing homes. So, what are the infections? Like healthcare acquired infections is methicillin-resistant Staphylococcus aureus, Clostridium difficile. These are the strong pathogens which can cause illness and death of the patient. So that's why we have to adopt this habit to hand wash and cleanliness. Diarrheal infection like Salmonella, E. coli, Shigella, norovirus, and respiratory infection like influenza virus, respiratory syncytial virus. Always wear surgical gloves when you may be in contact with blood, mucous membrane, and non-intact skin, because there is an infectious disease like hepatitis C virus, A virus, and other HIV virus can transfer from patient to doctor. And also, if your hands are not obviously dirty, wash with soap, water, or use an alcohol-based rub and gel. Always wear surgical gloves when you may be in contact with blood, mucous membrane, or in non-intact skin. So this is the uh, method. How can you clean your hand with soap and your gel? So I think they can sir, can we skip this, or we explain this? Okay, so this is the methods we can wash our hand. First of all, we have to take liquid, soap liquid, and first of all, we have to rub like this. Then after rubbing this, we have to move our hands like with fingers. Then after this, we have to do like this. Then This is the this is the seventh step. In the tips of the finger, you rub your tips of finger on your palm. Then wash your hand under water, and then dry it with towel, clean towel, which is sterilized. And then after that, you close the water with your knee, because the water is also dirty, so don't touch that water. So after that, wait for 2 to 15 seconds for dryness, and then you can wear gloves and other things. Next. So now the previous slides about the how to approach the patient. Now we will uh, discuss the main history taking skills. So this is the information biodata of the patient. First of all, we ask the name, age, sex, nationality, home, residence, occupation, material status, and date of admission. Name is important for identification and to be familiar with the patient. Age, because some disease is related to some specific age. That's why we ask about it. Sex, some disease are more common in males and females, like autoimmune disease most commonly in females. That's why we will ask about it. And nationality, certain diseases are related to certain countries, like TB is most commonly in Asia, in India. So home and resident, certain diseases are related to certain areas. Occupation, some diseases are related to certain occupation, like asbestosis in factories, so they can cause mesothelioma in the lungs, and lungs cancer in some smoke, where there is smoke. So that's why we will ask about these information. Now we will go toward Dr. Abbas. So he will, according to this information, he will ask this, take this information from his patient.
So, your fellow Dr. Irfan not only started to share and revise your knowledge, but also aware you what as a doctor and as a medical professional how you should introduce yourself and behave with the patient. These are known as medical ethics, and in this slide, these were prominent. This was a very good section. So, well done, Sachin. You can start, Doctor.
Assalamu alaikum. My name is Dr. Muhammad Abbas. I'm here to take your history. Can you love me?
Yes.
Yes. Okay. Can you tell me your name, please?
Muhammad Ayaz, son of Mr.
Okay. What is your age, please?
24.
24 years. Okay. Are you married?
No.
No. Okay. What do you do?
I'm a student.
Student. Okay. Where are you from?
I'm from Beijing City.
Which one is city? When did you admit to the hospital?
I'm admitted today, 28.
28 February. From where are you admitted, from the OPD or casualty?
OPD.
Okay. Okay.
Okay, next, after taking the biodata and personal information of the patient, now we will going toward the presenting complaints and the chief complaints. So what is the presenting and chief complaints? It's a main complaint. Doctor, that patient comes to the hospital, so ask the patient to describe their problem using open question. And what is open question? Just there are two types of questions, just like one is open and one is closed question. Open question just ask generally, what is your problem, what's brought you into the hospital. After that, if the patient is say I have this problem, then ask about the specific thing about that problem. That is the closed question. So in this, the presenting complaint should be expressed in the patient own words. I have a tightness in my chest. So this is the tightness in my chest. If we next ask the question about tightness, kind of tightness is like pain. So this is a closed question. So do not interrupt the patient first few sentences if possible, because they are really explaining the main problem. So don't interrupt, okay? Try to elicit the patient ideas, concerns, and expectations, like for example, I'm worried I might have cancer, I think I need some antibiotics. The format of the chief complaint should be written in chronological order. What is chronological order? If the patient have chief complaint like headache on and off. This table is example. So if the presenting complaint headache on and off for the last 2 years, so the problem which is lasting like for long time, 2 years, we keep it on the first priority. Then breathlessness, shortness of breath for the 2 months at the second, and the chest pain since today as the last. Means chronological order is a order in which we put the symptoms according to the duration. Longest duration at the first and shortest below. So next, in the next slide, so now we will going toward Dr. Abbas. He will ask about the chief complaint of his patient.
Okay. Mr. Ayaz, can you tell me why you come to hospital? What's your problem, please?
Doctor, I have upper abdominal pain from last few months, about 5 months.
Okay. Do you feel any other problem?
No.
Okay. Will you continue?
Next. Then history of presenting complaints. Now the patient have as Ayaz said, our patient Ayaz said he has upper abdominal pain. So this is his main problem. Now we will ask about the history of presenting complaint, means his upper abdominal. We will ask some specific question about his upper abdominal pain. So description of the chief complaint, like mode of onset, we will ask about the onset, acute, subacute, insidious, its progress, its duration, positive plus important negative points about that chief complaint. Use patient own words, and do not put leading questioning suggest their own answer. And because don't say from your side, just listen to the patient what he want to say, and record relevant associated symptoms, general complaints like appetite, loss of weight, fatigue, sleep, bladder, and bowel habits. So as I already said, so these are the types of question: open and closed question. As I previously mentioned, open question, tell me about your illness, like chief complaints, what happened next, and this is the open question. And closed means if he said one chief complaint, like as our patient said he have upper abdominal pain, so now we will ask close question: when did this begin? Who have like it's if it is chest pain, have you had chest pain? Has anyone in your family had similar troubles, and do you smoke? Like these are the close questions we will ask about the this main problem. Next. Next. For example, in the history of presenting complaint, we have a example. If we take the example of a smoker, 65-year-old male smoker. So who can we ask open and close question? These are the examples. After that, Dr. Abbas will ask the specific question about the patient problem, like he have upper abdomen, but our example is about male smoker. So first question, what would you say is the main problem? This is the open question. This is the question from doctor side, and the answer: I have had a cough which I cannot seem to be get rid of. I think it started after I had been ill with flu about 2 months ago. I thought it would get better, but it has not. It's driving me mad. So next question is, can you tell me a bit more about the cough? It's also an open question. Well, it's bad all the time. I cough and bring up some phlegm, and I cannot sleep at night. Sometimes waken up feeling rough because I have slept so poorly, and sometimes I get pain in my chest because I have been coughing so much. Follow up by asking the key question to clarify the cough, and tell me about the pain. What well, they are here on my side when I cough. Next. So these are the open questions. Does anything else bring on the pain? Open and prominent. No. Follow up this by asking the key question about pain. What color is the sputum? Because he have a smoker and 65-year-old, so cough and sputum. We will cough and we will ask about the sputum. And what color is the sputum? Close question, because he have cough and he is related to the lungs, and sputum is produced in the lungs. So this is a close question related to this condition. Focusing on the symptom offered. It's a clear. Have you ever cough up any blood? It's also close question. Yes, sometimes. Next. How often? It's also a type of close question, because we are questioning about a specific condition. So this is the type of close question. How much? And do you ever get wheezy or feel short of breath with your cough? How has your weight been? Close question, and seeking additional confirmation of the serious pathology. Like if he is a smoker, maybe he is diabetic, and maybe he is chronic bronchitis, bronchiectasis. So these are the questions we can ask from the presenting complaints to the patient. So as we know, he also have pain. So we can ask history of pain, ask the patient further question about the presenting complaint, like history pain. So just use pain history, like we can use Socrates mnemonics like site, onset, and character, radiations, and associated symptoms, timing, duration, course, and pattern, exacerbating, relieving factor, and severity of the pain we can ask. Now we will go toward Dr. Abbas. He will take specific history from the presenting complaints. As our patient Dr. Ayaz said, he has upper abdominal pain. Now our question is related about upper abdominal pain.
Okay, thank you. Okay, Mr. Ayaz, can you tell me how your pain start? Can you tell me about it more a little bit?
My pain start after upper abdominal pain.
Yes, sir.
Please be loud.
Okay, okay.
I feel at midnight when I wake up. I feel this pain after eating 1 or 2 hours later.
Can you tell me exact side part of the pain?
It's upper abdominal pain here
Upper abdominal.
and localized.
Okay. For how long the pain started?
It's around for 1 hour.
1 hour.
Yes.
Okay. Do you sleep with pain or not? You feel like they disturb your
Yes,
sleep or not?
my sleep is disturbed. I
Because
wake
of
up
it?
at night because of pain.
Yeah, okay. How the pain, like at like sharp or dull pain? Can you tell me about it?
It's dull pain.
Dull pain. Okay. And when the pain get increased, can you tell me?
It increased after 2 hours eating.
After 2 hours getting. And what you do when the pain is increased? Do you use any medication or not? What?
Yes, I use white medicine for
Huh?
that pain.
White medicine. Okay. Do you name the? Do you know the name?
Yes, smoking.
Okay. Okay. White medicine. Okay. And is the pain related to the other part of the not?
No, it's not related.
Not related.
It's
Okay.
localized.
Okay. Okay.
Now, after asking a specific question about the upper abdominal pain, which is the chief complaint, now we will go toward the past medical history. So, past medical history, we will ask this question: have you had any serious illness that brought you to see your doctor in previous months and previous time? Have you had to take time off work because of ill health? And have you had any operation? Have you attended any hospital, clinic? Have you ever been in hospital? If so, why was that? If the patient is unsure of their medical problem, ask them further clarifying question. For example, what do you usually visit your doctor for? Remember, you can add to past medical history if any of the medication later mentioned do not match the medical problem listed. And in the past medical history, they may know these medical problems very well. They may forget some. To ensure some are missed, so we can use these mnemonics, and we can ask about myocardial infarction, jaundice, tuberculosis, hypertension, rheumatic fever, epilepsy, asthma, diabetes, stroke, and cancer, because these are the main problems in any population they can occur. And also risk factor, because As part of medical history, ask about specific risk factor to their presenting complaints. If we take example of myocardial infarction, we can ask about like smoking, cholesterol, diabetes, hypertension, family history, and of ischemic heart disease. And but there are specific some condition we have to clarify of their past medical history. For example, if there is COPD, ask about when the patient was diagnosed, their current previous treatment, and when have they ever required non-invasive ventilation, and whether they have been uh, primary care. And myocardial infarction, ask about angina, previous heart attack, and previous angiograms, and previous stenting. Diabetic, duration of diagnosis, current management including insulin, control of diabetes, well, poorly controlled diabetes. So these are the past medical history, and now Dr. Abbas will ask about the past medical history of his patient.
Please, can you tell me any disease in the past they make your admission in the hospital?
No, I don't have past medical.
Okay. Do you have any hypertension?
No, I don't have.
Do you have any diabetes mellitus, sugar?
No, I don't.
Okay. Any other disease do you know
No, I don't have.
in the past? Okay.
So next we will discuss about the drug history. So in drug history, all medication that may take for each medication, ask them to specify their dosage, frequency, route, compliance, whether they take regularly, take these medication. If they take medication weekly, ask what day of the week they take it. If they take a medication with a variable dosing like warfarin, ask their current dosage, and also about the recreational drugs, like those drugs who can like they can recreate analgesics, stimulants like heroin, and other drug morphine, and IV intravenous drug, current or previous over the counter medications. Now Dr. Abbas will ask about the past medical history.
Can you tell me, do you use any medication?
I just use work medicine for this one.
Okay. Do you know other medication?
No.
No? Okay. What time do you use this what medication?
When I feel the pain, so I use this medicine.
Only when you have pain you use that medication. Okay. Okay.
Now we will discuss about the allergies, allergy to any kind of medications, and any type of allergy to patient. Does the patient have any allergy? If allergic to medication, clarify the type of medication and the exact reaction to that medication. Specifically ask about whether there is been a history of anaphylaxis, like there is throat swelling and trouble breathing, a puffy face, because these conditions can lead to the death. That's why these are the questions important to ask about the allergic history. Now
Okay.
Dr. Abbas will ask about allergy history.
When you use the medication, can you do you have any redness or itching on the skin or any other thing? Do you notice?
No.
Okay. Okay.
Now we will ask about the family history. As we know, some diseases are inherited, genetically acquired, so they can transfer from parents to children. So we will ask about the family history. Ask the patient about any family disease relevant to the presenting complaints. If the patient has presented with a chest pain, ask about family history of heart attack. Are there any illness that run in your family? Inquire about the patient parents and siblings. If they were deceased below 65, the cause of the death. If relevant and pattern has emerged from previous history and short family tree, document illness in the first degree relatives, parents, siblings, and the children. Now Dr. Abbas will ask about the family history of the patient.
Okay. Can you tell me, does any disease run in your family?
No, there is no disease.
Okay. Okay.
So next is the social history. Social history, most important, is about the alcohol and smoking. Alcohol history, we will ask about the alcohol intake, work out the number of unit per week, because there is a recommended and safe limit for men and women. For men there is 24 unit per week and women 14 unit per week. If we exceed that limit, there will be some trouble. So the question we will ask: do you ever drink any alcohol? Use open question. Giving permission for patient to tell you, and do not judge them. When did you last have a drink? What's the most ever you drink? And about the tobacco, quantity, the number of peak years, number of pack years, number of pack of 20 cigarettes smoked per day multiplied by number of the years smoking, and employment history, particularly relevant with exposure to certain pathogen like asbestos. When you were asked to about, so because asbestos can lead to mesothelioma, so we will ask about this question. And also home situation, because if the person is living in poor area, so in underdeveloping countries and poor areas, so they can lead to some disease. And next, uh, travel history, further social history may be required depending on the type of presenting complaint. For example, respiratory presenting complaints ask about pets, dust exposure, asbestos, exposure to the farm, exposure to birds, and any other hobbies. And infectious to disease related travel history, including all occasions, exposure to water, foreign particle, tuberculosis risk factor, HIV risk factors, and recent immunization. We will ask about that. In social history, these are the formulas we can calculate pack year of smoking and the alcohol units. And next, in the social history, we will ask about the sexual history. Are you currently in a relationship? And after this, Dr. We going toward Dr. Abbas. He will take social history about his patient.
Okay, yes, can you tell me, do you smoke?
No.
Okay. Do you drink any alcohol?
No.
Okay.
After taking social history, now we will going toward the systemic review, because there are multiple in each disease there are multiple system involved. So we will ask about the systemic problems. First of all, there is we take the general symptoms and general history. Fever, we will ask about their onset, course, duration, pattern, grade, association with rigor, convulsions, and skin rash, weight change, course, duration, how much associated, and we can ask, is it increasing, decreasing, stationary, is change in weight of recent onset, and fatigue and malaise. We will ask about any tiredness, fatigability, is there any general malaise, and also sleep. Has the pattern of sleep changed? Is there difficulty in getting to sleep, or there is early waking? Does the patient feel sleep during the day? Does the patient take any medication for it? And after taking general symptoms, general systemic review, now we will specify about each system. You know, our main case is about the GIT, upper abdominal pain. So we will mainly focus on the gastrointestinal system. First of all, we will ask about the upper GI symptoms. Like if there is upper abdominal pain, we will ask about what is the site of the pain, how severe it is. Is it continue, intermittent? Does it radiate to any side or direction? What is the duration of the pain? Is there any pain-free interval? If yes, what is the duration? Is pain related to the meal? Does it disturb sleep at night? What are the aggravating factors? What are the living factors? Food, vomiting, antacid, and about the appetite. Is it increased, decreased? If reduced, then vomiting. What is frequency? Does vomiting relieve pain? What is the color of the vomit? Contain blood and the residue of food taken the day before. When does it occur? Morning, evening. And flatulent dyspepsia. What the wind move? When does the wind move? Downward, upward. Does either relieve symptoms? Water brush. Does patient get excessive secretion of saliva into the mouth? Heartburn. Does the patient feel any pain, burning behind the sternum? Does it appear especially after laying down? Does sitting up has any effect? So these are the symptoms about upper GI symptoms, like dysphagia, any difficulty in swallowing, sticking of the food during swallowing, liquid, solid liquids, painful swelling, associated symptom, dysphonia, vomiting, and sore eructations, like patient experience acid taste in the mouth. Does it have any relation to type of the food? It occurred during laying down, any relieving factor now? So these are the questions we can ask about the upper GI symptoms. And next, lower GI symptoms like diarrhea. We can ask about diarrhea, what is the color of the stool, and what is the which part of the day it occurs, and is there pain during defecation, associated symptoms, incontinence, involuntary passage of the stool, and also constipation, what is the patient's usual bowel habits, and does constipation alternate with diarrhea, any colicky pain, any is there any blood in the stool, and also lower abdominal pain, localization, character, radiations, persistent, intermittent, and also relieving factor. A relieving factor by defecation, by passage of the flatus and abdominal distension, and also we can ask about the lower GI bleeding. So next, the other symptoms we can ask about next hepatobiliary system. So we can ask about jaundice. So these are the questions we can ask, and about pain, metastasis, and related to the cardiovascular system, if there is dyspnea, chief complaint, we can ask these questions, and about pain, discomfort, tightness, palpitations, and cough, edema, and other symptoms related to the cardiovascular system. And next is the respiratory system. In respiratory system, if there is cough, we can ask about dry, productive, and about the sputum quantity, and dyspnea, and also wheezing, pain chest, and metapoiesis.
What I want to say is, if there are some symptoms which are positive,
Yes.
these are the
Questions, sir.
follow-up questions, and these you have a lot of review of system,
Yes,
right?
sir. Yes, sir.
So after review of system, Ajay, go back from the respiratory system. Go to respiratory system. Okay, one by one for 3 seconds. Give each slide 3 seconds. Okay.
Yes.
Okay. Next.
Next,
No. It's okay. Please. 3 seconds. So that just they'll go in camera. Okay. Later you can revise. Okay. Next.
now after reviewing the all system, we get information related to each system. After getting information about chief complaint, past medical history, and about drug history, family history, and after getting all this information, we put it all together, means it's a summary. After getting summary with all the relevant information assembled, you should have a list of differential diagnosis before you examine the patient. Briefly summarize what the patient has told you, reflect this back to the patient. This allow patient to correct anything you have misunderstood and add anything you have forgotten. Gain the patient permission to examine. Now Dr. Abbas will give us a summary about his patient complaint.
Okay, at the end, I would like to summarize and present the case. Mr. Ayaz, son of Mr. Mukhtar Alam, 25-year-old male, unmarried, non-smoker, student by occupation, resident of each one, has been admitted to a hospital on 26 February 2023 through OPD with the following chief complaint in the epigastric region for the last 5 months. And history of present illness, he was well before starting. The patient started have pain in the epigastric about 5 months ago. It was moderate to severe in intensity, occur 1 to 2 hours after the meal. It is relieved by the white medicine, perhaps antacids. Patient usually wake up at night because of the pain, and it is localized. There is no history of vomiting or black stools. Appetite is good. Increased weight for the last few months. In the past history, there is no admission in the past for any disease. There is no hypertension, diabetes mellitus, ischemic heart disease, or TB. And social history, he is student, economically supported by parents, hygiene are good, non-smoker, non-drinker, regular exercise. He is doing regular exercise. Family history, there is no disease in the family. There are 4 brothers and 1 sister. No any disease in them. Treatment, he is taking white medicine for the pain, and he is taking good food to relieve the pain. So on the basis of my presentation, my differential diagnosis would be peptic ulcer, gastritis, cholestasis, pancreatitis. So
Next.
to differentiate this,
Next.
So when you have less time and you are summarizing, basically you give your summary to the patient and ask, correct me if I'm wrong. You have to present, okay, have I noted correctly? So while summarizing, if you don't have time, you don't need to say the negative findings that he does not, the patient does not have this, you don't have this, you don't have this. Only the positive findings. Yes, and
Yes.
and in the end, you can ask again. Correct me if I'm wrong, and if you want to add something, and then you say on the basis of this summary.
Now, after giving the differential diagnosis, now we will do a physical examination according to signs and symptoms, and next is a laboratory investigation. The main objective of investigation is to reassure the physician and the patient before proceeding with any investigation. Discuss the likelihood and the significance of normal test result with the patient, and patients are more likely to be satisfied with your explanation, make sense to them, remove blame, and help generate ideas about how they can manage their symptoms. And next is the definitive diagnosis and the treatment plan, which is according to their physical examination and the main and the investigations.
Okay.
So that's all. That's our case and history presentation. And thank you so much, everyone.
Steady, gimana? Saya dah mal steady,